You're listening to Streetside, the Street Medicine Institute Student Coalition podcast.
Hello, and welcome to Streetside, the official podcast of the Student Coalition of the Street Medicine Institute. Today we have two guests from Albuquerque, New Mexico joining us, and I'd like to ask them to introduce themselves. The first guest is going to be Lindsay. And Lindsay, please let us know a little bit about your background and what you do.
Well, thank you, Michael. It's lovely to be here. My name is Lindsay Fox. I'm a physician assistant at the University of New Mexico in the Department of Internal Medicine, but also a co-founder of the Center for Inclusive Health, which houses our mobile medical team. This mobile medical team has been active since about 2022 with incredible private support from people in the community, our city, and the university itself. We serve most folks in Bernalillo County, which is the county with which Albuquerque is in. We have two vehicles that we also procured through a private donation that support the team with supplies. The important thing about these vehicles is they really adhere to the Street Medicine Institute principles of serving the people, go to the people. They're trucks that help folks remain in their community, to keep the power, to keep it patient-led, interprofessional, interdisciplinary, and sustainable.
That's beautiful. Thank you for those details. Mm-hmm. Two questions. The first question would be, when you say a Center for Inclusion Health, tell me more about that. What do you mean by inclusion health?
It's actually inclusive health.
Inclusive, yeah.
Right. When we first started this, we, as a group at the university, with our department, really thought about what our intentions were. And rather than just be healthcare for unsheltered folks or migrant care, we decided that we would care for everyone. Albuquerque and New Mexico is a really special place. We have a tricultural community, which includes First Nations folks, people who have been in New Mexico since the early 1400s. Their families go back way before the founding of the United States, as well as a lot of migration from Central and South America. And then also settlers that came across through, from the West Coast and just settled from the East Coast and settled in New Mexico. So we take care of everybody. We have a really robust cultural history. Some of it does have the stains of colonialism, which you can see are very evident even in our healthcare delivery systems and our policies. But we really were dedicated to making sure that we would care for you regardless of who you were, what your origins are, your insurance status, your immigration status. That was really the focus of this new center at the University of New Mexico.
And how are you funded?
So we're funded in a variety of ways, primarily by private donations. Again, New Mexico is just an incredible place, and the University of New Mexico alumni has been very instrumental in providing us resources to build this program out. They saw the value of developing a medical program that not only cared for the most marginalized folks, but also provided space and time to teach up-and-coming providers. So we have a robust resident and medical student and oncoming PA student engagement. We also get funding from Medicaid, so we can bill for our street visits, which has been part of our sustainable project. We're continuing to work out grants and funding from the city, hoping to get together with the county and the state to continue to provide the care that we can.
Tell me the scope of your operation. How many clinicians do you have, or staff? How big are you?
Well, I say we're small but mighty. So it's myself, my medical director, Dr. Sarah Doorley, and we just onboarded a CHW MA. We also are fortunate, since we work with a flagship university and a learning center, we have the availability of psychiatric residents, fourth years, which are almost clinically independent. So we have a regular street psychiatrist that comes out with us at least once a week.
Oh, that's fantastic. That makes a huge difference with this population. Yeah. I also wanted to ask you, you spent some time talking about the vans that you have, the mobile units. There's a little bit of controversy around that in street medicine movement. That is, if you're on the street with your backpack, you're at the people's level, and you're not in a sanitized medical facility of any kind. And there's purists that say, oh, we should be out there with our backpacks and not on the mobile units. I'm curious about, was that a philosophical or question for your organization to think about whether we use vans?
Looking back, it absolutely was. The state had floated the idea of allowing us to have one of those big mobile 26-foot units, and we intentionally chose to go with small pickup, a Ford Ranger, if you will, that houses all of our equipment and basically lawn chairs and a tent. And so when we're out walking the streets, we have our backpacks, but there are times when we do pop-up clinics where we set up a tent and lawn chairs. It almost looks like a family reunion or a barbecue, if you will. And people are sitting together, and the providers are able to sit next to the patient and really engage in private conversation about their health.
That's a beautiful image, a family barbecue. Yeah.
Yeah, it's kind of funny. Music sometimes, goldfish, water, snacks.
Some people would think it's a tailgater.
It looks like that. We drop down the tailgate and use the tailgate as an exam table if need be.
Yeah. Oh, great. Tell me, as you're both an administrator and a clinician, so what does that look like week to week? How many hours are you out on the street? How many hours are you doing administrative tasks? And tell me about I'm curious mostly about your clinical time.
Yeah. Right now, my clinical time is 3.5 days a week. I would love to do more clinical time. And when I first got into this, Michael, the reason I did was because this was the care I chose to practice. I had this amazing opportunity to work with unsheltered folks in Albuquerque. But then as I leaned into it more, I saw that there was just this absolute desert of healthcare, and that folks that were living on the street weren't receiving the care they needed. And so then I had to put on an administrator hat and figure out a way to build a program that could be sustainable, patient-led, interdisciplinary, and interprofessional. And so that really forced my hand and said, if this is what you want to do, you've got to build it. So between grant writing and meeting with folks and visiting with legislators and convincing private donors that not only does this make sense fiscally from a expense standpoint for reducing emergency room costs, it's what we need to do as a community. This is who we are, and we deserve to take care of our brothers and sisters on the street.
Thank you for that, and so true, right?
Yeah.
And one of the difficulties in the population that we serve is the social, relational poverty that accompanies being unhoused. And it sounds like you are building community as you provide medical care out on the streets.
We are really trying to do that. We're, one of the things we say to folks on the street is, we see you, we hear you. And when we bring people in, we also ask that they see people, because as Dr. Withers says, once you've seen it, you can't unsee it. And sometimes it's not always convenient. Sometimes it's not always gentle. But unless you recognize it and hold space for it, then we don't have the opportunity to really make change. Again, keeping it patient-led. Dr. Liz Fry had a great quote earlier this week. Instead of patient-centered, where we're all focused on the patient in the center, I'd like to think about it more as patient-led, having the patient have that autonomy. So that's what we're trying to initiate with our program at the University of New Mexico.
It's challenging, is it not, to when there's situations that I find I get into with a patient or client where respecting their autonomy and agency is one of the hardest things I have to do. Do you struggle with that at times when you clearly see a clinical intervention that's going to help someone and they're saying, no way?
I absolutely do. And I think I was talking with Dr. Doorley, our medical director, earlier today, and I think a lot of that is a hangover from the medical system that we come up through our medical education, through some of the oaths that we took that empowered us, either correctly or incorrectly, to bring change to folks who may not want it or aren't ready for it. And so it really causes a shift in our brain to think about what is the most important thing for the patient, and not settle into this paternalistic delivery care system from which we all came up through. So when we are doing street medicine, we really have to check ourselves, look at our biases, and kind of stop and make sure that our language remains patient-led, because I don't think in medical education, it might be patient-centered and it might proclaim to be patient-oriented, but I'm not sure that it's patient-led.
Tell me as a clinician, as a healer of sorts, how has this work healed you?
That's a great question, and I think about that a lot. When I think about the work that I am able to do, it's an honor. It's an honor to sit in community with someone who allows me to share in their world and learn their story, which is sometimes boundless, and really learn about what the human spirit is capable of enduring, as well as the resiliency. And when people ask me why I do this work, I say that it inspires me to develop this resiliency muscle because I bear witness to some things that I can't even imagine living through, and these people do so, and they remain graciousness and the care that they provide not only for each other but for their animals is pretty fascinating. And so to be able to witness that in its purest sense has been one of the greatest gifts that working in street medicine has given me.
Thank you. Beautiful. And last question, I'm going to ask for a story. You mentioned narratives, you mentioned stories of the people, and I'm curious about that. Is there a certain interaction you hold in your heart that you reflect on?
Oh, I have so many, and I'm so fortunate. I think there's one actually that I'm struggling with today. We have a gentleman who is living out on the streets. He's very familiar to our team. He's very familiar to the law enforcement. He's very familiar to the carceral system. Everybody knows this gentleman. And as a result, because they know him, judgments have been made, and he's still living on the street, incredibly ill. And we can't figure out how to get care for him. And so as I sit here talking with you, I think about ways that we can make interventions, continuing to keep it patient-led. And it reminds me that we can't give up, that we're really in this for the long game. This gentleman, unfortunately, I think most of those systems that I mentioned prior have banned him, deemed him uncooperative. He's got every label known to him. And the last label that I hear named for him is humane and human. And so as I sit through street medicine this week, I'm constantly thinking about ways I can go home and serve this individual better. So that's one story that's been sticking with me. But again, so much of my life is richer for knowing these folks out on the street and spending time with them and allowing them to share their stories with me. We call ourselves medical providers, but I really think we're story keepers. And I treasure those stories and I keep them close and safe.
Thank you. Thank you. It sounds like you really love on your patients, and that just comes through with everything you're saying.
Oh,
so
thank you, Michael. We
yeah.
try. Times are hard sometimes, but
right.
I think that's love. Love is probably the best medicine. We've heard it over and over today, is keeping that in the forefront to really help patients heal.
Thank you. Sarah from Albuquerque, tell us about yourself.
Yeah, my name is Sarah Doorley. I am an internal medicine, addiction medicine physician, currently working as the medical director of the University of New Mexico Center for Inclusive Health, which is our street medicine program. I have wandered all over and have landed in Albuquerque about 7 years ago. Love it so much and have found it as my home. So I feel very lucky to be there. Mm-hmm.
I want to hear more about the wandering. Okay, tell us where did the wandering start, and what's been your journey to get to this work?
Oh gosh, yeah. How far do I go back? So it began in Ohio. Both of my parents were very focused on sort of service to others. Started at the food bank, feeding the hungry from the time I was a very young kid. Always enforced, choose whatever you want to do, but choose a profession of service. Landed in the field of medicine, went to med school in Ohio, did my residency in New York City, where I really sort of started to learn the field of social medicine, understanding how these large-scale social forces affect health in very big ways, and that we as healthcare providers have a role to sort of interact with those. Dr. Paul Farmer, like global health equity expert, always says this best, where diseases make a preferential option for the poor, so therefore should we as healthcare providers and healthcare systems. And that always struck me as really true. I initially entered into medicine through global health in addition to the service. I've worked in Palestine and Haiti and El Salvador. a variety of different places. And at some point just realized that that was not going to be my long-term home, and was lucky enough to realize that a lot of those skills, practicing medicine in austere settings, navigating different cultures, having a preferential option of service and treatment to the poor, really aligned with the field of street medicine. So landed in street medicine in 2009, and will be here for the duration. Mm-hmm.
Fantastic. Is this your full-time employment?
Full-time at UNM, I'm about 30% street medicine at this point, and do a little bit of teaching and primary care also.
Okay. Do you teach medical students?
Yeah, teach medical students and residents at the University of New Mexico.
Oh, fantastic. So a question for you here, and that story was tremendous. I'm wondering, with your time in El Salvador, and knowing you a little bit, that you speak Spanish, how has that been helpful for you in the work that you're doing now with street medicine?
Oh, yeah. I'm such a strong believer that we as providers should do everything we can to learn skills to be able to better relate and serve the folks that we're working with. I think that really comes from, my residency training program, whereas if you saw someone with hepatitis C, you should learn how to treat hepatitis C. If you're working with a group of folks that are monolingual Spanish, you should sort of learn how to speak Spanish. And obviously it's not always possible to do, but I've been very grateful for that time in El Salvador and for the community that taught me Spanish, to be able to just better relate to the folks that we sort of see. Most of our folks are English speaking in Albuquerque. It's probably like 5 to 10% sort of are monolingual, but to be able to interact and engage with them on that level has been really beautiful. And
I'm sure they appreciate it. Someone that speaks their native tongue. Mm-hmm. I'm going to ask you a similar question to what I asked Lindsay. Tell us some stories. Tell us some stories that have touched your heart in this work.
Yeah. I think the one I've been thinking a lot about lately is a woman that both Lindsay and I are still working with quite a bit. She's just a really charismatic human, mostly stays sort of downtown Albuquerque. So once a week or so, Lindsay and I and team will have the ability to interact with her. And as it goes, it's been a bit of a process of just engagement and relationship building. She also is just incredibly sick with both severe mental illness and active substance use, and rough sleep sort of downtown Albuquerque. But it's been really beautiful sort of over time. The team, which has, some peer support workers, Lindsay, myself, and our MA, have just gotten to know this woman over time. At some point, she was asking for treatment for various symptoms and agreed to some mental health medications, and has done really well sort of on the medications we've been able to provide to her on the streets. But the thing I think that reason I've been thinking about this woman in particular is because recently I went back through her chart. She's 26 now. And the first time she was at UNM, she was 16 years old. And if you go back over the 10 years, it just becomes so clear both the incredible amount of these adverse childhood events that she struggled with, the tremendous amount of trauma that she had, and you're just sort of watching her over time go from this teen with some depression and anxiety to more significant mental illness and more significant substance use. And it just sort of felt like our system had failed, this woman. And the amount of sort of traumatic insults that she has suffered over time was just remarkable. And I guess what are my thoughts on her? When we think about, street medicine, you're thinking about ways that you can walk beside people. You're sort of acknowledging, like what Jim Withers says, we're all flawed humans and forgivable humans, and we're sort of showing up together in that space. And, I don't know. Sorry, I'm rambling. Yeah.
You're doing fine.
Yeah. So, I think I just feel really grateful to be on street medicine. I'm frustrated that our system has failed so many individuals. I am grateful to be on a team to try to respond, even if it's 10 years too late. And, I think to be able to be out there and see the whole person, all of their strengths, all of the resiliency, all of the struggles, all of the system failures, and just to commit to continue to walk beside them feels important to me.
Oh, good. Thank you. Thank you. That's beautiful. And I'm curious then, Sarah, you're involved in the education of the next generation of clinicians, be they physician, medical students or residents. Tell me about that. What values are you trying to imbue them with and share and pass along to your students?
I always think back to Jim Withers on this question. Jim Withers talks about how the roots of street medicine were really founded in the education of medical providers. He acknowledges that you can't actually learn medicine unless you go outside of the brick and mortar health systems. That's so often the way we learn medicine and practice medicine in hospitals and clinics does not reflect the reality of the lives of the individuals that we're working with. And so I think in street medicine, through the inclusion of learners, you're able to really illuminate, a way to practice medicine, engage with the community that is based in the reality of the lives of the people, where they're at and how they live.
Fantastic. I've got two final questions for you. One is going to be, if you were to give advice to the listeners as to what they could do to make the world a better place, what would you put forward?
This work has been so humbling in so many ways. I think it constantly challenges your assumptions. It constantly challenges the order that you sort of have placed the world in. And when you're going out there, when you're listening to the stories of people, where you're getting to know them as humans, all of those assumptions just go away. And you're really remembering that we're all humans, and finding that commonality that's shared between all of us.
Thank you for elevating our common humanity. It's so critically important. Yeah. And last question is, how can our listeners connect with the Albuquerque Street Medicine program? Is there a way that people can connect with you?
We actually have a really interesting program that's going on right now. The University of New Mexico and our Street Medicine Center for Inclusive Health teamed up with Project ECHO and the Street Medicine Institute. And once a month, the second Monday of each month, we have a hour-long ECHO session that includes a didactic where you can earn free CMEs. And then we have an opportunity for attendees to do a case presentation, or we open up discussion. ECHO's a pretty powerful tool if you're not familiar with it, but what it does is a couple of things. It is, we call it the democratization of knowledge. So the goal is to get the knowledge to the people who need it the most. The second part is creating community. One of the things that Sarah and I, Dr. Doorley and I, love about coming to Street Medicine Institute conferences is we get to see so many old friends, meet new friends, and engage with people that are doing our work. Not only do we learn, but we have this shared camaraderie. And that really helps us continue to do this important work. And we thought if we could recreate that once a month in this virtual setting, it would help not only our practice, but possibly help other small and large street medicine teams across the globe. So that information I can forward to you. It's just like the Street Medicine Institute, very low key, very warm and inviting, user friendly. Topics range from, the literature-based treatment options to how to engage with trauma-based informed care, cultural sensitivity, CHW topics. So it really spans the entire spectrum of the team.
Could our listeners access the ECHO sessions through the Street Medicine Institute website?
They can. There is a QR code on the website, and they can just go to the website and open up the QR code, and it will take them directly to Project Echo, where they can register and get notifications of upcoming sessions.
And are there any limits to the number of attendees?
I don't think so. I think
No?
we could probably, what I would like to I would like to see what the limit is. So I'm going to present a challenge to your listeners that if everybody come, and if we exceed the limit, then I will hustle a larger Echo.
Fantastic. Lindsay and Sarah, it has been such a joy and a pleasure to have you on Streetside today. I have learned a lot, and it makes me want to come visit you in Albuquerque, as I'm sure many of our listeners would like to come and see the good work you're doing. So thank you for what you do, and we appreciate you presenting your program here on Streetside.
Thank you, Michael. Take care.
Thank you. Bye now.
The opinions expressed in this podcast are those of the individuals included and are not representative of the opinions of the Street Medicine Institute or the Street Medicine Institute Student Coalition. Do not use this podcast as medical advice, and instead see your own provider for medical care.